Good afternoon, everybody. My name is Ted Burton. I'm Vice President of Communications at Central Health. We want to welcome everybody who's watching us via Facebook Live or Zoom. We appreciate you joining us today for this info session on COVID vaccine boosters and third doses for adults. And there is a difference in vaccines for pediatric patients. As everyone here knows, widespread vaccines are key to stopping the spread of COVID-19 in our community and keeping each other safe, especially with the holiday season right around the corner. Today, our expert panel will talk about who is currently eligible for boosters and third doses and pediatric vaccines, and we'll discuss current plans to get vaccines out into our community, especially in areas where vaccine rates are lagging. We will wrap up, and then throughout this conversation provide information about how you can find the nearest vaccine to you. If you are joining via Facebook Live, please include questions in the chat and we will answer as many as possible, but also know we're going to share this presentation online, and if we have questions that we don't get to or cannot answer, we will respond via Facebook. So they will be available. We can also send them to you via email or however you might prefer to receive them. As we have throughout the pandemic, Central Health is honored to partner with our affiliate CommunityCare Health Centers and Austin Public Health for this information session and all the work that we've been doing along the way. So I'd like to introduce our panelists. Today joining us is Dr. Desmar Wachs, Austin Medical Director and Health Authority. Thank you, Dr. Wachs, for joining us. I know your schedule is really busy. Tara Trower, the Chief Strategy Officer with Central Health Affiliated CommunityCare. Hi, Tara. And the Chief Medical Officer for Central Health, Dr. Alan Schalscha. After a brief presentations by our panelists, we'll open up the floor for questions. If you're joining via Facebook Live again, you can just put questions in the chat. So let's get rolling, and we'll start with Dr. Schalscha. Dr. Schalscha, could you just please tell us who is currently eligible for boosters and third doses?
Good afternoon, everybody. Can you hear me okay?
We hear you fine, thank you.
Great. I'm going to break my answer into two different buckets, and really based on the mechanism of action of the actual vaccinations itself. So first, I'm going to talk really about mRNA vaccines, and these are the Pfizer and the Moderna. And as related to who should receive this booster, any individuals 65 and older should absolutely get the booster. If we look at the pandemic and the individuals who are most susceptible to disease, about 80% of the folks who have died from COVID have been 65 or older. So if you're 65 and older, please go get your booster. For folks who are 18 and older and live in long-term care facilities, please get your booster. For those who are 18 and older and have an underlying medical condition, you too should receive your booster. And some examples of some of those long-term medical conditions are individuals who have a diagnosis of cancer, chronic kidney disease, chronic liver disease, lung disease. And so we could be talking about people who have chronic asthmatic, basically outbreaks of asthma or COPD, dementia, neurological diseases, diabetes, Down syndrome, heart disease, mental health conditions, individuals who are overweight or obese, and then those folks who are pregnant. In addition, for folks who are 18 and older and live or work in kind of high-risk settings, you too should please receive that booster. And some examples of those folks are first responders, healthcare workers, firefighters, police, education staff, so teachers, support staff, daycare workers, food and agriculture workers, manufacturing workers, corrections workers, U.S. Postal Service, public transit, and grocery store workers. I'm going to next go to the vector vaccine, which is the Johnson & Johnson vaccine. And anybody who received the J&J vaccine and is 18 and over, or would be 18 and over, 2 months after you receive that vaccine, please go and get your booster everybody that received the J&J should have their booster 2 months after that.
Dr. Schalscha, does it matter which vaccine you got first, or does the CDC recommend you can mix and match?
So CDC, there are lots of studies that are still being conducted, but at this point, CDC does say it's okay to mix and match. It's still recommended if you received an mRNA vaccine to consider having that vaccine first. So if you receive Pfizer or Moderna, consider having Pfizer and Moderna as your booster vaccine. If that is unavailable, go and get your J&J. If you received a J&J vaccine, any vaccine that you can have access to, go and get that vaccine as your booster.
Thank you. And also something that you and I talked about before this meeting, could you explain the difference between a booster shot and a third dose?
Absolutely. So lots of individuals get confused when discussing boosters versus third shots. Third shots are really just referring to individuals who have completed the vaccination series. So, and specifically talking about the mRNA series. So they've had their first shot and then their second shot either 21 days later or 28 days later. And for these individuals, they're severely immunocompromised or moderately immunocompromised. And so their immune system didn't really kick off a robust immune response. And therefore, they should receive basically a third shot 28 days after they received their second shot, right? And so when we're talking about kind of a booster versus third shot, the booster is really given because the immune system is slowly decreasing its response. And the third shot is given because the immune system never really kicked off that robust response that's seen in folks who are not immunocompromised.
Got it. Can we now talk about pediatric vaccines?
Absolutely. So for individuals who are really 5 and up, this is a great opportunity to get your children vaccinated. COVID is a serious condition, not only for adults, but for children. Kids of all ages have gotten incredibly sick and have died from COVID. Again, in disproportionate numbers, we see older individuals, but COVID is a serious condition for any age of individual.
So regarding pediatrics, there is a lot of information out there right now, some of it misinformation. But one of the things that we've heard is kids, if they get COVID, don't get really sick. But I just saw today, actually, I think it was out over the weekend, a report out of the UK, which says 1 in 7 kids suffer from what they call long haul syndrome. And I just wanted to know if you could just address the importance again of why kids need to get vaccinated.
Thanks, Ted. Just to restate it, the majority of kids can have mild symptoms, but even if it's 1 in 7, I mean, that's your child, it's a family member, it's a neighbor, critically important. They can get incredibly sick, they can be hospitalized, and they can die. So, the fact that we can now immunize from 5 and up is a great advantage we didn't have previously. So folks need to get immunized.
And also, we mentioned at the top the importance of getting vaccinated now as we move into the holiday season. People are going to be gathering with families. And so getting children vaccinated helps protect family members, siblings, extended family, others that might be traveling.
No, so it's a great point. Because kids may be mildly symptomatic, we may consider that they have kind of the common cold, and therefore not take them in, to test them for COVID. Though the majority of kids won't get acutely ill, if they go home during the holidays and there is a senior family member or there is somebody that has various comorbidities, they stand or they pose a significant risk to those individuals. And so we may not know that they have COVID, but preventing them from potentially getting that sick or from passing on the disease process, let's get them immunized again.
Thank you, Dr. Schalscha. I know we're going to come back and talk more about pediatric vaccines, but I did want to bring into the conversation Dr. Desmer Watts. Dr. Watts, thank you for carving out a little bit of time with us today. I know you've got a lot going on as well, but we have some slides that you shared. Just to start out with, and we'll come back to this one because we're going to talk about the how and the where people can get vaccinated, and children can get vaccinated. But do you want to give us a brief update on kind of where we are as a community regarding COVID-19?
Sure.
I think it's the next slide. Oh, one more slide. Thank you. Okay.
Next slide, please. Thanks, Alan, for that brief on the boosters and pediatric vaccines and just vaccines in general. I show this slide to talk about what we've learned, and our experience during the pandemic shows that masking, social distancing, and isolation when sick are effective at decreasing the spread of COVID-19 in our community. And you'll see these peaks and valleys. And during the peak times, we've used those things in those first two surges to help get us to the other side and get case numbers down. In the middle of the January surge, or just before the mid-January, we started using vaccines to also help combat COVID-19. And then during that July surge, in the middle of that surge, we had an order issued for masking. So we've seen all along that what we knew to help keep the spread from person to person from occurring was helpful. During this last surge with the Delta variant, we found that that virus in that variant is much more contagious. It causes more severe symptoms than earlier variants that we'd seen with the virus, because we had higher amounts of the virus infecting people, regardless of their vaccination status. And because of the combination of decreases in hospital staff that we were seeing locally and the sharp increase in COVID cases that we saw in early July, extending up into August, we had fewer hospital ICU beds and hospital beds available. And we saw pediatric ICU beds in the region become stressed as well. And the next slide, please. I want to just reiterate why this particular conference that you're having today is so timely. The top two slides represent what's happened over time in the Austin area, and the bottom two slides are what's going on in El Paso. And I think you've heard us say that we are constantly looking at what's happening in other areas, either in the UK, in Europe, and in the Midwest and Colorado. We're seeing increases in cases. In the UK in particular, we saw that they had fairly good vaccine rates, but with the decrease and decline in use of masks, and with people not going to get those booster shots, we saw increases in the numbers of cases that we were having over time. And we're starting to see that sort of thing a little bit closer to home in El Paso. And having spoken with my counterpart in El Paso, he's seeing this happen because of waning immunity or decrease in that immunity that people have from that initial series. So boosters are really important. And even though children are less likely to have serious outcomes from COVID infections, they still have the ability to contract and transmit that infection to others in the home, which can result in more cases community-wide. So increases in that transmission or spread of COVID in our community will add strain to our hospital systems and medical personnel that are already strained by that. So wearing masks in school settings as per the CDC guidance, and also getting our children vaccinated will help with in-school transmission, school outbreaks, school closures, and also decrease our community transmission. As we know, we can get those COVID and other things like colds and flu from kiddos, especially during these holiday times when we're going to be indoors celebrating with family and friends. So I urge you, everyone, to spread that message of protection, multi-layer protection with masking and vaccinations. And with that, I'll stop talking and pass it back over to you. Thank you.
Thank you, Dr. Walks. I had a question regarding the risk-based guidelines, and there was a change. I believe it was last week, maybe it was the week before last, where you're now factoring in a weekly transmission. Can you explain? Because people, they may see that the hospitalizations have gone down and fatalities have gone down, but yet the risk-based guideline remains where we've been. Could you just talk about why the weekly transmission rate is so important?
So what we see with the hospitalization numbers that we've been tracking is the availability for care in our hospital systems. And we started this out by realizing that we needed to protect our hospital system and the ability for people to go to have care. When we look at the community-based transmission, we're looking at the number of people in our community that are currently walking or have COVID-19. And some of them may have the disease and not know it. They may have asymptomatic disease. And others may have had the test result come back to them that's positive. And as we know, before they test positive or have symptoms, they can still be spreading the virus. So the likelihood of somebody being exposed out in public to COVID-19 is something that we're assessing with the use of the cases per 100,000. And it's going to be the thing that we use and the CDC is currently using to guide us on what recommendations should be made with regards to masking indoors. And that's particularly important right now as we are moving into a season where people are preparing for festivities, they're shopping, they're going out into public indoor spaces, particularly where ventilation is not so good. And the use of a mask will protect those that are unprotected, either because they're not vaccinated or their vaccination has been more than 6 months ago in the case of the mRNA vaccines, or more than 2 months ago in the case of J&J vaccine. And they need to get that booster to get them the increased protection they need to prevent severe disease, hospitalization, and death.
So it sounds like for now, the recommendation is if you are getting out and doing shopping or gathering indoors, as you said, still recommending masks if you're around people who you don't know their vaccination or COVID status?
Yes, sir. Yeah.
Okay. We're going to circle back to you in a minute, Dr. Watts, to talk specifically about what Austin Public Health is doing to get vaccines in the community, out in the community, both for adult booster third doses and pediatrics. I know it's something that literally is changing by the day regarding what school districts are doing and other organizations. But I do want to bring into the conversation Tara Trower with CommunityCare, so she can talk about what CommunityCare is doing regarding the distribution of vaccines, specifically for community care patients. So we can go to the next slide. Thank you. Hi, Tara.
Hello. Thanks so much for having me, Ted. It's really a pleasure to be part of this conversation. Before I go sort of into exactly what we're doing to reach out to our patients with regards to the COVID-19 vaccinations, as you saw the chart that Dr. Walks had, it really represents for us the challenges of working in this pandemic. I think as many of you are aware, we worked really, really hard to do expanded community vaccination during the first wave when the vaccines first became available to the public. And then kind of moved and contracted to smaller sites where we still did community vaccinations. And then we got hit by Delta. which required us to flex and change again to restart some community testing while still trying to get folks vaccinated. And now here we are with boosters and pediatric vaccines available and recommended. And that has really required us to kind of shift our strategies. The good news is that there's much more vaccine available within the community than there was back in March, which has allowed us to pull back some and really concentrate on our patient population, which represents some of the most vulnerable members of our county and community. And so CommunityCare and our Carousel Pediatric clinics are offering children's vaccines and boosters for our patients only by appointment. One of the reasons why we are asking for appointments rather than sort of the walk-in model that we've done before is that early experiences with healthcare really sort of shape our community's interactions going forward. And while it's not a huge deal, depending on who you are, to wait in line and kind of go through an extended experience, we really want to make sure that our pediatric patients have a smooth and good experience where they're with their parents, with their providers when we can, to go ahead and get them vaccinated at their home clinics. Children and adult patients can receive their shots at their medical home. And unfortunately, due to the demand for pediatric vaccines and adequate staffing, one of the things that we've had to do is pull back from community-wide adult vaccination centers. I will say that in recent months, the demand has really shifted. And before we shut down our 4 remaining community adult walk-in clinics, we were only down to about 100, between 100 and 200 for an entire month. And I think that really reflects the much wider availability of vaccine in our community, the work that our partners at Central Health, Austin Public Health, as well as the resources that are now available at pharmacies to allow for vaccination close to home, no matter where folks are. It's still free, no matter where you go. And so we've been reaching out to our patients via text and when they make appointments, always asking if they hadn't gotten them already, if they haven't been initially vaccinated. But for those populations who are at high risk and are recommended to get either boosters or third shots, that is part of our outreach as well.
Thank you. And Tara, it's on the screen, but just a reminder for CommunityCare patients, how should they go about scheduling an appointment?
They should go ahead and either schedule in my chart or call us directly at 512-978-9015.
And my chart is the patient portal for CommunityCare patients, correct?
Yes, yes, that is correct. And because things are shifting, if there's ever a question about what we're offering, we post our updates on our website, which is also listed on the screen right there, communitycaretexas.org/coronavirus updates.
Thank you. I'd like to go back to the fact sheet that we had up earlier regarding pediatric vaccines. And I wanted to circle back. Well, and we're going to open this up for everybody, but Dr. Wachs, could you talk about Austin Public Health's efforts to get pediatric vaccines out into the community? And some of the information is on the fact sheet that's there on the screen.
Sure. We have conducted a survey for the parents of children in our ISDs for all of the ISDs in Travis County and received over 10,000 responses.
Wow.
And they've indicated that in large part, I would say 80% have plans to use their provider, their physician or healthcare provider as their source for vaccine for their children. And the other 15% are split between the school setting and then the other areas where they're also considering our community vaccine clinics. So when they also talk about provider, they're also talking, when they say healthcare provider, they're including in that the pharmacists and the pharmacy locations where vaccines are available for pediatrics. So we have a good representation of all of those facilities through CommunityCares and other FQHCs, local clinics, and pediatric providers. And we at APH are available to assist providers who may not want to take on the larger quantities of vaccine. As you know, we're using Pfizer vaccine for children 5 to 16, and a different formulation is being used for the 5 to 11-year-olds. It has a different diluent, a solvent, and it's handled differently. So particularly with that in mind, if there is someone who's registered to be a COVID vaccine provider and they don't want to take a larger quantity of vaccine, they can contact Austin Public Health and we can transfer vaccine to them for use in vials. The vials themselves for the 5 to 11-year-old group can be stored in a refrigerator for 10 weeks. And that's different from the other Pfizer products. So that's a difference and something that makes ease for storage and handling. And as for what we're doing at Austin Public Health, we are partnering with our school districts and setting up vaccine clinics. The schedules are posted on our website. And we also have a static location at the old Sims Elementary School and at Delco. And then we have a mobile vaccine unit that's available as well. Again, call 311 or Health Equity line, and they can give you information on that. And then our Travis County Vaccine Collaborative is also working with Title I schools. They're collaborating with the UT School of Nursing and Constable Morales, and they're going to several of the Title I schools in the Eastern Crescent to host and hold vaccine clinics for pediatrics as well.
Thank you, Dr. Watson. I just heard that I think this week Del Valle is starting to offer vaccines for pediatrics 5 to 11. I believe it was on all the campuses, but I don't want to misstate that fact. But
yeah,
I'm sorry.
If they look on vaccines on the website for us and also for the county, the times for each of those vaccine clinics will be listed.
Thank you. And that I know that is changing almost daily. So it really is important that people check the website to see where we are with these vaccine opportunities. And also, Austin Regional Clinic is scheduling appointments, and the number is 866-453-4525. And then as several, you all mentioned, commercial pharmacies, CVS, Walgreens, HEB, others are also distributing vaccines for children. And Dr. Wax, I know Austin Public Health has been really focused on about 10 priority zip codes where vaccine rates are lagging. So trying to get vaccines into those communities, correct?
Yes, that's correct. We are doing that with vaccine pop-up clinics and with the mobile units. And our county partners are also doing the same thing at El Mercados and various sites in and around the zip codes where we have seen a not as robust response to vaccinations. It's slowly happening, and one person at a time, we're getting people vaccinated.
And how are those publicized, those pop-up events? Are they just literally pop-up, or are they promoted in advance?
We have community health workers that are publicizing it in the communities. Prior to, there are people that are leaving flyers in community grocery stores and in other communities areas where people can access the information on dates and times. In some of our churches, it's been publicized in church bulletins, and in some cases, the churches themselves serve as sites for vaccine clinics.
Thank you for that. And speaking of community health workers, I wanted to mention also that Central Health's community health workers are continuing to reach out to our medical access program members or MAP members via telephone to let them know which vaccines or who is available for the vaccines, including boosters, third dose, and pediatrics. We are also continuing to do, we've been doing this throughout the pandemic, but visiting small businesses and organizations and faith-based communities in zip codes where vaccine rates are lagging and dropping off information and enlisting those businesses and organizations to help continue to get the word out. And then, as we've been doing throughout the pandemic, also coordinating with Austin Public Health and CommunityCare on paid but very targeted advertising. So again, on those zip codes, we're focused on where either MAP or MAP eligible members live. Using very directed, or I should say very direct, paid social media. So primarily Facebook ads and then radio advertising. So working in like today's info session, just to get accurate information out to all of the groups that we work with, our networks and partners, so that they can help amplify the message.
We've also had 2 town hall meetings to talk to our community about what worked and what didn't work in all of our work collectively, all of the providers. And so the targeted messaging has been helpful. The community really appreciates the translation of materials into preferred language, such as what you're seeing here on the slide that's up, and the ability to have people to not only translate language, but for those who require sign language, to have that available as well. So all in all, I think that as a team collaborating, all of our providers have made good strides in trying to reach out to the community, and will continue to do so. This booster symposium that we're having today is good, because I think people are needed to hear from Dr. Schalscha about what it is that a booster is and what a third shot is. And that's something that has been a little bit confusing, I think, for the public. So I'm hoping that people will get out there and get those booster shots now, so they'll be protected for the holidays.
Thank you, Dr. Walks. We do have a few questions that I'm going to pose here, and anybody is welcome to chime in. And also, if there's something that we didn't cover that you would like us to cover, or anything to reiterate, we will do that as well. A question, and this is likely for Dr. Schalscha or Dr. Walks: are boosters made from the same formula as existing vaccines?
I'll give Dr. Walks a break. She's been providing so much significant or critical information, so let her rest for a sec. So boosters are absolutely made from the same, existing vaccine formulation. I think the only difference that exists as far as the vaccination or the vaccines is what Dr. Walks referred to, and that is really the formulation of the vaccines from ages 5 to 11. Is kind of 1/3. It's prepared differently, and it's kind of a third of what the 12 and up really receive. Other than that, when somebody receives a booster, they receive exactly what they were vaccinated with.
And as a follow-up, if you are you still considered fully vaccinated if you haven't had a booster or third dose, or has that now changed?
No, so completion of a vaccination series for the mRNA vaccine, so for Pfizer and Moderna, that's completion of the 2 series. And for J&J, it's really, now everybody's recommended to have the 1, but it's completion of having that, everybody with J&J is recommended to have kind of that booster 2 months later. But completion of a series is completion of the 2 for the mRNA and the 1 for the J&J.
Is the dose for kids the same as the dose for adults? And Dr. Walks had touched on this, or is it different?
So the dose for kids, I think I just stated, but the dose for kids from 5 to 11 is different from the dose from 12 and up. And so I think one of the questions that parents or guardians may have is, you know, if my child or the individual that we're considering is 11 years old and they receive shot 1, let's say, you know, from Pfizer, and now they turn 12 because it's 21 days later, you know, which vaccine do they get? And the vaccines are dosed by age, not by weight. And so if they're 11 when they would receive kind of that, you know, the lower formulation, and if they turn 12, they don't start the series again, they would just get the normal shot that adults would receive.
Gotcha. One thing I want to make sure we touch on, I think we have a slide for this, is the fact that we can't forget we're also in flu season. And so the importance of getting a flu vaccine, if we can go to this slide, I think there's one at the end. But I would like either Dr. Walks or Dr. Schalscha, could we talk about just the importance of who should get the flu vaccine and why it's so important, and perhaps even more critical when we've got 2 situations, COVID-19 and potentially, well, not potentially, it is flu season, but we don't want a flu outbreak.
Okay, Dr. Walks, I'll defer to you. I'm happy to answer this, but want to share the limelight. So I'll defer to you on this one.
Sure. So the flu is also a respiratory illness that is transmitted by air droplets. The virus is transmitted by air droplets, just as COVID-19 is. And last year, when we were seeing a lot more consistent use of masking, we had very few cases of the flu. This year, as we start our season of respiratory illness, we're seeing increases in the number of cases of flu anecdotally and in our surveillance system where providers are reporting to us. So on any given year in the past, when we've had a flu season that was bad, it has taxed our hospital system, right, because we haven't had enough beds. So this year we have 2 potentially disturbing situations that could happen: a surge in the flu cases, an increase in the number of flu cases, and an increase in COVID-19 cases. So it's important that we protect ourselves with the things that we know work: masking and vaccinations, staying home when sick. So we're asking for people to get 2 shots. You got 2 arms, 1 COVID, 1 flu, get her done. So we're hoping that we'll get that message out, and I'll pass it back to Alan.
Thanks. Nothing else to add, but 6 months and up, please get your flu shot.
Thank you, Dr. Walks. Dr. Schalscha. Dr. Schalscha, you've covered this, but we do have another question. I think it's reiterating the response to mix and match, but somebody's asking, they'll soon be eligible for a booster and would like to hear your perspective on the benefit of sticking to Pfizer, which was their previous 2 doses, or the mix and matching with a Moderna booster. Would there be a preference? Is it the same?
So it's a great question. Right now, there hasn't been overt evidence in one way or the other that shows one way to be more advantageous. You know, if you've got an mRNA vaccine, the thought is stick with the mRNA vaccine. If you received Pfizer and you have access to Pfizer, get Pfizer. If you received Pfizer and you only have access to Moderna, get Moderna. You know, whereby the thoughts with the J&J are you may want to consider having that mRNA vaccine. So if you have J&J, you may want to consider either the Pfizer or the Moderna.
Got it. So again, the most important thing is just get it, right? As you said, Dr. Walks, get it done.
Yes, definitely get it done.
That's a good and simple message. I'm not seeing more questions. I did want to give, we have our president, Central Health's president and CEO, Mike Giesland is joining us for this conversation. Mike, are you there?
Yes, I'm here.
I wanted to welcome you, Mike, and see if you had any additional or final thoughts for us.
Yes, thank you. And thank you to everybody that's joined us on Facebook Live and to those that have presented here today. And, just back when this pandemic started, we worked closely with members in the community, advocates and neighborhood groups and community groups to get information out there. And this is another step in this process as we're hopefully nearing the end of this pandemic and maybe moving into a more endemic type era, but nonetheless, getting out there with facts, addressing some of the concerns and issues as it relates to boosters and third shots and flu season, so that we can all be ambassadors for those that we're privileged to serve and the communities that are the hardest hit. And, we can't do this without you. And so again, I'm very thankful to those that presented today and those that were able to join us on Facebook Live and help us get information out there as we go about working at events or working in our day-to-day settings in terms of bringing about health and health equity. So thank you all very much. Let's stick together.
Thank you, Mike. We appreciate your input. This isn't a question, but we did have somebody, and I wanted to share this with our panelists. Somebody just said, thank you for all your diligent research and care benefiting all of us. So I wanted to make sure you guys are working so hard that you also hear those who are grateful for the information and grateful for your work. I can open it up for final thoughts, and I did want to just remind people that they should check with their child's healthcare provider regarding vaccines or to schedule an appointment. For community care patients, as Tara mentioned, you can schedule through your patient portal or call 512-978-9015. Austin Public Health encourage you to check their website, austintexas.gov/COVID-19-vaccines. I know that's a mouthful, but you could just Google Austin Public Health to get the latest on where vaccine locations are happening, because they do seem to change almost by the day, or call 311. Another simple, easy website where you can type in your zip code and find vaccines near you that we've been using for a long time is vaccines.gov. And I know this is a lot of information, but also remember those commercial pharmacies like CVS, Walgreens, and HEB are now offering boosters and third doses and pediatric vaccines. You just need to check their websites or call to either make an appointment or see if they are offering walk-ups, same-day appointments, because it's going to be different by location. I want to allow folks to make a final point. Tara, I know you had something that you wanted to add.
I did, and certainly thank you again, everyone, for watching. And while the focus of our conversation has certainly been around the health benefits, I just wanted to put in a plug, particularly around the pediatric vaccinations. Kids suffered a bunch last year in terms of falling behind due to the inability to attend school, and vaccination and masks are one more tool to making sure that the kids are able to stay in school and continue to make progress and make up the ground that they lost. At CommunityCare, we spend a lot of time thinking about what we call the social determinants of health, and one of those is educational attainment as well. And so just, yes, we want to keep everyone safe. Yes, we want to keep everyone healthy. And I suspect if the superintendents of the school districts were on here as well, we also want to keep them in school.
Spoken like a true parent, by the way.
I am too.
Dr. Schalscha, Dr. Walks, any final thoughts before we give you back the rest of your day?
I think going into the holiday season, just really wanted to wish folks, from Austin Public Health's on their behalf, from CommunityCare's behalf, and also from Central Health's behalf, kind of a happy and healthy holiday season and New Year. And nothing says, Happy New Year better than having good health, close friends, and a family that can be together and celebrate each other. And a way that we can really move in that direction is by getting vaccinated. So happy holidays, everybody. Get vaccinated.
Thank you, Dr. Schalscha. Well said. Dr. Walks?
I want to thank Central Health Community Cares for putting this together today, and echo what Dr. Schalscha has said, and also say that if you are having any symptoms and you're not quite sure and you're going home to visit Granny or somebody that might be at risk of getting sick from COVID-19 or the flu, but particularly COVID-19, please get tested before you go home, just to make sure that you're not taking a gift that you don't want to take back home, and make sure that you have a safe trip and to whatever your destination is, and enjoy your family. That's something we all miss, so thanks.
Good message. We were having this discussion over the weekend too. We are moving into yet another allergy season, so people we don't need them to self-diagnose if they're having COVID symptoms. They should get tested and know their status for sure. So thanks, everybody. We really do appreciate our panelists. And as Mike mentioned, we really appreciate our partnership that we've had throughout this pandemic and beyond with Austin Public Health and CommunityCare, and working together to get accurate information out into the community, but of course now to get vaccines out as well. And with that, we want to thank everybody who joined us. Remember, this presentation will be available on Facebook Live, so you can share it with others who may want to watch. And if you have questions that we didn't answer, or you think of something later, please post those questions and we will monitor those and respond and post answers as well. So thank you again, everybody. We do appreciate your time. As Dr. Schalscha said, happy holidays, everybody. Thank you.
Thank you all.